Hey guys, good afternoon. Dr. Pierre, your favorite board certified internist, founder at drpierresblog.com, author, speaker, soon to be podcaster, bring you another edition of the Lunch and Learn. As always, much appreciate you guys stopping by. I want to give a shout out to my replay viewers. I know a lot of you guys are going to be watching later on this evening or whenever you do watch it. Definitely appreciate you watching and continuing to support yours truly. Today is a special day, which, again, I'll be honest, I didn't even know until earlier this week. Today is actually World Kidney Day. I know, you'll see that, especially in healthcare. It seems like we have a lot of days for a lot of things, but, we got a lot of medical issues to deal with. So today's World Kidney Day, and, we're going to talk about the kidney, an important body part that, when I'm going to actually run down the list of some of the things the kidney does. We don't realize how much work it does until it stops working. And so, like always, just going to quickly do a quick homework. We're just going to share like I always do, and then we can get this started. Hey, Jen, thank you for joining. Every time I have to share on my regular page. Hey, Amanda, thank you for joining. Let's see where we get this thing started. I want to share my own page. All right, that's shared. So again, just want to quick recap. Today is World Kidney Day. If you did not know, you are not alone. It's a day that actually got enacted a little less than 10 years ago. So it's not, it hasn't been around for years and years and years. But it's definitely a special day, especially for someone in the primary care setting like myself, who takes care of a lot of patients with kidney disease. And this is something I think probably one of every 3 to 4 patient of mine has some issue with their kidney. And today we're going to do, like we always do, a quick little education on what the kidney does. We'll throw in some fun facts here and there, and really kind of talk about the importance of the kidney, and why we need it to be working as much as we need it to be working. And then we'll kind of discuss a little bit about the kidney disease states, in particular chronic kidney disease, and we'll kind of go into those motions of what kind of defines chronic kidney disease, and what do we do to try to quote unquote prevent it. And there'll be a little caveat there as far as treating chronic kidney disease. So again, first of all, chronic kidney disease, World Kidney Day. Let's talk about just some general functions of the kidney. Number one. Makes urine, and that may seem like obvious, but when you take care of patients who are on dialysis and they don't make urine anymore, which means they don't go to the bathroom no more. If you just thought about that, think about it. You guys have been using the restroom for 20, 30, 40 years. So imagine just one day never having to use the restroom again, right? So that's crazy. Hey, Gino, thank you for joining. Makes urine. That's the number one thing. Our kidneys also, get rid of waste. The kidneys, and then, for example, and just to tell you, the size of the kidney is about the size of your fist. So, these two organs, and you have two kidneys, unless there's some problems, you have two kidneys, and the amount of work that they do that happens in the size of your fist is just flat out amazing. So, definitely want to make sure that the kidney is an organ that definitely gets its just due, which again, I'm happy it's today's World Kidney Day, so we're going to celebrate it in that regards. So we talked about blood pressure, so it takes care of blood pressure. We talked about getting rid of waste. We talked about making urine. It also helps control just the balance in general, as far as from a chemical balance. It actually helps create red blood cells. Red blood cells are what we use to consider like blood. Red blood cells is our blood. Red blood cells, help us with energy and all these other different functions that the kidney is an extreme part of. And we know that the kidneys are pretty much responsible for about 25% of like the body's like cardiac output, and that's why it has such a big player in regards to blood pressure in general. Hey, Dr. Jerry, thank you for joining. So again, quick functions: makes urine. Again, everyone makes urine as long as your kidneys function. Takes care of waste. Takes care of all of the other different chemicals in our system. Helps regulate blood pressure. Also helps with healing in that itself. And again, these are two organs that are the size of your fist. So let's talk about why we have an issue with chronic kidney disease, and why is kidney disease even an issue in and of itself. We know the top two choices, and we've talked about this on Lunch and Learn in the past. Top two causes for a patient to have kidney disease is high blood pressure and diabetes. And if we think about that, the kidney is a very vascular organ. It deals with a lot of the blood on a consistent basis all day, every day. So when we're having issues with high blood pressure, when we're having issues with diabetes, and diabetes, I know a lot of people think about diabetes in the sense of like sugar. But diabetes is a vascular problem in and of itself. Like sugar is just like a function of it. But like the real problem with diabetes is that it's a very vascular disease. So, of course, if it's a vascular disease, we expect, an organ that deals with a lot of the blood, like our kidneys do. To really blunt the rate, face, the blunt of all of those disorders. There is some autoimmune issues that can affect the kidney disease. There's some infections that can affect the kidney. But when if we had to list our top two choices, if you had an answer choice, diabetes, hypertension is going to be a big one. Also, again, my dreaded smoking, right? What does I probably say this probably once a week. Like, what does smoking not cause a problem with, right? So smoking is another cause for a patient to undergo chronic kidney disease. So definitely a lot of disease courses and stuff that we can kind of take care of in and itself on our own. And chronic kidney disease is kind of defined by 5 different stages. If your kidneys are completely normal, no issues, no injury, nothing, you're in stage 1. And, we don't really need to talk about the in-between, 2, 3, and 4, because the most important one, which, a lot of us are very familiar with, is stage 5. So once you get to the point where you're stage 5, that's what we consider end-stage renal disease. And those are for your patients who are on dialysis. So if anyone has family members or friends, or just know of anybody who's on dialysis, they'll tell you that it's probably one of the most, draining procedures they have to go through. Dialysis usually takes, especially if they do hemodialysis. There is 2 different types. We won't get into specifics here. It's not important. But the dialysis that most people undertake, they usually go about 3 times a week. And they usually have to sit in this chair for 3 hours. And, so the question is what are they doing sitting in this chair? We kind of talked about the functions of the kidney, right? We talked about how the kidney regulates blood pressure. We talked about how the kidney makes urine. We talked about how the kidney, takes care of the waste. So imagine of all of those things that the kidney's done, it can't do no more. So now you run the risk of having too much fluid in your system. Why? Because the kidney make urine to get rid of fluid. You can't get rid of your fluid. Now you have too much waste in your system. Why? The kidneys used to get rid of that waste. Your kidneys don't work anymore. Your blood pressure is just crazy. Why? Because again, the kidneys used to be, the control center for your blood pressure, and now that doesn't do it anymore either. So there's a lot of problems. And again, remember, these are 2 fist-sized organs. That's it. These 2 fist-sized organs do the work of. Probably if I had to rival it, it's probably brain, heart, and then kidney, right? If we had to list an order of the most importance from an organ standpoint, we could throw lungs in there too. But really, it's me, brain, heart, kidney. That's where I think kidney lies in its level of importance. And the problem is, once you're moving from these different stages, once you're going from stage 1 to stage 2 to stage 3, there really isn't any going back to stage 2, right? A stage 5 kidney disease patient isn't going to really go back to stage 4 or stage 3. Once the damage is done, that's it for them. For a healthy kidney, person who's in stage 1, half of that kidney can do the work of a full person with a person with 2 kidneys, right? So just to give you the amount of work that that kidney has to do. But what occurs is, and let's think about, I like to think about it like this. When we first start out, let's say we have 1 million workers, right? And each kidney, doing the work, getting rid of, making urine, controlling blood pressure, doing all these things here. But as time goes along, and now you get to stage 2, now you only have, 750,000 workers. Again, but they still have to do that same amount of work as the 1 million workers have to do. Now you get to like stage 3, and now you have 500,000 workers who still has to do that amount of work that the 1 million used to have to do. Stage 4, 250,000 workers. Again, that's still, so imagine, so just think about it. So you have less people still having to do the amount of work that 1 million used to have to do. So we can see why, a problem is going to arise. And by the time they get to stage 5, by the time they get to the point where their kidneys are like, you got like 10 workers, and they're not even the best workers. They're the ones who didn't really do any work. But now that the rest of them, almost 1 million guys are like, off the job, like now they gotta do all the work. That's why those patients end up, on dialysis, because again, they just can't do it by themselves anymore. So and that's concerning, right? Because again, we talked about what the top 2 causes for it: blood pressure and diabetes. So you mean to tell me if this patient could have just took their blood pressure medication, or just say, let's just assume they weren't diagnosed, right? Let's say if this person wasn't diagnosed, if they were just diagnosed with their blood pressure 10, 15 years ago, if they were just diagnosed with their diabetes 10, 15 years ago, and I could have put them on that one medication 10, 15 years ago, they wouldn't have to be dealing with dialysis. They wouldn't have to be sitting in a chair for 3 hours. They wouldn't have to be mentally and physically drained every time they get at dialysis chair. If you some of you, I'm pretty sure, have relatives or family members who are on dialysis. Ask them like how they feel right before dialysis. Ask them how they feel after dialysis. They usually tell you they're like, but before dialysis, they're kind of like groggy. They're not feeling their best. They feel much better after dialysis, but after that, they sit in that chair for 3 hours. They're pretty much done. Like they're done. They want to rest. They want to sleep. They don't really want to do too much work. And then what happens? You get that buffer day where like, okay, wow, I'm feeling good now. I had dialysis, on Monday. Tuesday, I'm moving. By Tuesday night, you start feeling a little sluggish again, because remember, your waste is still kind of rising. You don't have that normal kidney that's getting rid of your waste in your urine. You don't have that normal kidney kind of doing that job on its own. Then they start feeling sluggish again by Tuesday night. Wednesday come, oh, it's time for dialysis again. So these patients, unfortunately go to this cycle of up and down, not feeling good, not feeling good, feeling good, tired, more tired. Those patients usually they're just always tired. It's not even a point where they're like never not tired anymore. And and that's what I feel bad for them, because especially I have a few patients in my practice now who I know if I would have got out of residency, like again, 5 years, I'm not even saying 10. If I could have got out of residency 5 years earlier, and talk to this patient 5 years earlier, and put them on this blood pressure medication 5 years earlier, they probably wouldn't be in dialysis right now, but they are. What can you do? And of course, who's affected, right? Who's affected by dialysis? My caveat, my minority patients, African Americans, Hispanics, and it's like we're affected more. Why? Because we're affected more by diabetes. We're affected more by hypertension. We're affected a little bit more by a lot of these autoimmune diseases. And then because we're affected more by all of these primary diseases, and we don't get treated with these primary diseases, we end up on dialysis later on. So again, it's I hate to sound gloomy, but that's what it is. So I think we have to really stress the importance of kidney function. Like again, I think it's something that get kind of gets brushed off. Remember, these are 2 fist-sized organs, but they're doing so much work that that they don't get appreciated until today, right? Until past 6 years, right? Today is World Kidney Day, so we're talking about the kidney. Tomorrow I'll write a post on probably 10, 15 different facts on the kidney as well, because I think a lot of people are surprised just how much work the kidney does, especially if you don't know, you don't know. But that's what I'm here for. I'm here to actually educate you guys and get you moving into the right motion. So let's say how do we prevent it, right? Like, Barry, how do I prevent myself from going on dialysis? Because again, because now that's a concern, right? Like, how do I? Because I done told you about the gloom of dialysis. So how do I prevent myself from going dialysis? We know that kidney function is related to blood pressure. So one, control your blood pressure. You control your blood pressure, you control the likelihood of you having chronic kidney disease. You control the likelihood of you going down that road where dialysis is concerned. Control your blood sugar. Like, again, we're thinking about diabetes in a sense of sugar, and that's because that's what, most people kind of deem it as. Like, when they say you're diabetic, they're always telling you about your blood sugar. But really, in an internist standpoint, like, your blood sugar is like, okay, yeah, your blood sugar is high, but I want to know what that high blood sugar is doing to the arteries in your kidneys. I want to know what that blood sugar is doing to the arteries in your feet, to the arteries in your heart, to the arteries in your head. Like, that's what I want to know what the blood sugar is doing. Not really for the sense that you have high blood sugar. It's just because I know high blood sugar causes damages to all of these other things here, and particularly the kidney. And I think it flip-flops. Like, if you flip a coin, and diabetes is the number one cause for a patient being on dialysis. Flip a coin another year, and hypertension is the number one cause. So it's really important for us to, really hammer home that fact. So number one, like, how do I prevent myself from getting chronic kidney disease, getting dialysis? Number one, control your blood pressure. Number two, control your blood sugar. Number three, really just try to be more fit, because we know obesity has some negative influence on our kidneys. Why? Because again, the obese patients, again, kind of going back to it, tend to be hypertensive. The obese patients tend to have high blood sugar and high cholesterol as well. So, be fit, exercise well from that standpoint there. Drink plenty of fluids, plenty of fluids, because in the acute setting, because we talked about chronic kidney disease, but there are some patients who will acutely have kidney disease, whether it's due to like being severely dehydrated, whether it's due to like drugs or anything in that regard. So there is a concern from that aspect. Well, but our main focus is like the chronic aspect, like, because the acute you can reverse. Acute, I can go back from stage 4 back to stage 1. But if it's chronic, there's no going back, right? So we got to make sure we try to prevent the chronic. And then, of course, last but not least, again, I'm going to do a lot more on the post tomorrow. Don't smoke, right? Like, again, I think I say this probably once a week, right? If you still are smoking cigarettes, yeah, like, if you still are smoking cigarettes, I feel like I don't need to say it. If you still are smoking cigarettes, I don't know what is wrong with you. And I'm really talking to these people who are like picking up smoking now, right? I'm not talking, because I know I got patients who've been smoking for years. When I was pre-med, when I wanted to be pre-med, they've been smoking cigarettes. Those let me work. I'm working on those, right? But if you were on 2017, right, picking up, going to the store to go pick up a pack of cigarettes because you want to try it out, like, stop it. Like, stop. All these problems that cigarettes smoking causes. If you do not learn by now, like, that smoking cigarette is a problem, like, we can't even feel bad, right? We can, and this course, it's crazy when you hear a medical profession say that. But like, I don't know anywhere else to say, right? If you are going to pick up a cigarette in 2017 for the first time, I don't know what I can tell you. I don't know. Like, I mean, the evidence is there. All of the numbers are there. Pick a cancer. Smoking causes an increased risk of it. Pick a disease, diabetes, heart attack, stroke, smoking. Don't smoke, right? So like if you don't learn anything, I think this is episode 24. If you have not learned anything from these 24 Lunch and Learn episodes, is that Dr. Berry does not want you smoking cigarettes. That's it. Like, that's where you should get from. Like, if you don't get nothing else, if you don't get heart disease, heart failure, like, if you don't get diabetes, if you don't get nothing else, is Dr. Berry does not want you smoking cigarettes. So no smoking cigarettes. So that's our last one here today. Again, be on the lookout. Blog post will be out tomorrow. Again, we'll probably do like 10, 15 facts on the kidneys that you didn't know about. So 10, 15 facts, be on the lookout for that. If you have not had a chance, go ahead and sign up for that listserv. That way I can get it right to your email box and you don't have to go to a website. You wake up in the morning and my article's in your email. So sign that up today. Like, don't do it tomorrow. Second I press finish on here, you go and sign up for that. drpiersblog.com or Dr. Barry Pierre. It's the same thing. It'll go to the same place from that standpoint there. Let's look at some questions. Yes. So so we're done with our kidney issue. So Amanda talks about people who are on dialysis who have the ports, right? Because and again, we didn't even talk about dialysis. I mean, we actually, maybe we'll talk about dialysis probably next week. But there are some people who are on dialysis who have to, have a port actually surgically inserted, just so I can get the dirty blood out to put clean blood back in, right? There's some patients who have to go through that on a weekly basis. And again, you've got this foreign body here, that's just, could risk for infection is up there. It's always a concern for us. And if you see your dialysis studies and your dialysis nurses, some of the cleanest nurses, because they know that they can't have any infection around the dialysis portion. Yes, no smoking. Yeah, exactly. If you're smoking, you're asking for problems. So definitely, dialysis patients, always, there's a lot of issues that dialysis patients always get concerned about. Like imagine, being on dialysis and not being able to have a bag of chips anymore. Because again, your kidneys that used to be, working, churning, when you have that bag of chips and the salt level rises and your fluid builds up, normally your kidneys would get rid of that fluid. Now you don't have kidneys to get rid of that no more. So now you got to get like dialysis just to get the fluid out. Like there's so many things that kind of go with, the end-stage renal disease dialysis. Like, well, in fact, we'll talk about that. We'll talk about that next week, just to kind of get that out there. Because again, kidney disease is definitely something that I deal with on a day-to-day basis, and it's definitely something of importance. So we definitely want to make sure we are, hitting that home. And again, when you have something like World Kidney Day, what better day to do it, right? So again, I am Dr. Barry, your favorite board-certified internist, your favorite blogger, your favorite author, your favorite speaker, your favorite everything, doing episode 24. Yeah, wow, we did 24 episodes. That's nice. 24 episodes. Hey, Dr. Shanika. 24 episodes of the Lunch and Learn. You guys are much appreciated. Again, to my replay viewers, much appreciate you guys for, watching it later. And like I said, if you have questions on my videos, go ahead and leave it in the comments. I always will get back to you and answer them at the later time. Yeah, thank you. Oh yeah, Dr. Shanika, I figured Dr. Shanika's out there on the West Coast. She said, good morning. I'm like, it's like it's almost 1 o'clock on the East. Good morning, Dr. Shanika. That's America's favorite family physician over there. Please check that out if you want. Go ahead and check her. Check out Dr. Jarrett as well. That's America's dentist. I have a lot of powerful friends, if you notice, and I appreciate them for stopping by on our Lunch and Learn. So you guys have a great, blessed day. Learn something if you haven't learned something about the kidney today, I hope you learn now. Tomorrow, be on the lookout. Blog posts coming on, 10, 15 things you didn't know about the kidney that you know now. You guys have a great, blessed day. I will see y'all later. Bye.